Hi, Richard with Northwest Advanced Medical Massage, also known as Natural Movement Therapy. And I have my own theory about what causes the vast majority of chronic pain in human beings. And it has to do with your feet. I have the genetic condition called Morton's toe. You can see that my second toe is much longer than my first toe. When I walk with my feet turned out. I notice that about 80% of people with Morton's toe externally rotate their feet, and about 20% internally rotate their feet. So it's very important, if you decide that you're going to try this shim experiment, you're doing so at your own risk. I do not guarantee results. I'm not a doctor. I'm a massage therapist. If you have any increase in your chronic pain symptoms, take the shim out of your shoes and go back to doing what you're doing. I've seen that happen in one occasion, and a client promptly took the shim out of their shoes. Their chronic pain did not increase. So I find this successful very high percentage of the time, and I just suggest it. You can try it. If it works, great. If it doesn't work, you're out $3.50 in a little bit of time. Dr. Dudley J. Morton discussed Morton's toe and its association to chronic pain back in the 1920s. I believe it was 1929. He actually patented a shim. So Morton's toe, I think, is more than just simply a long second metatarsal. If you have a hypermobile first metatarsal, so as you step, that ball of the foot bends out of the way, that is just as causes just as many problems as having the short first metatarsal. So in both cases, the shim under the shoe, the shim under the ball of the foot, provides the support, the kinesthetic support, so your feet track straight ahead instead of externally or internally rotating. So what does Morton's toe possibly have to do with chronic pain? Well, in a nutshell, I think absolutely everything. Because what I also notice is when people externally rotate their feet, their pelvis tilts anteriorly. So if you look at a gentleman's belt as he's walking, you'll see that his belt slopes down towards the front. When people internally rotate, then almost always their pelvis posteriorly tilts, and then their belt will point or slope up. So women should have between a 10 and 20 degree anterior tilt, and men should have between a 0 and 10 degree anterior tilt. Nobody should have a posterior tilt. Think for a moment what happens if your pelvis is tilted more than normal. The curve in your spine becomes much more than normal. So what I've also noticed are those people that I have seen who have spondylosis or spondylolisthesis, they also have a significant anterior pelvic tilt. When your pelvis tilts, your lumbar spine has an abnormal curve and your head winds up thrusting forward. How many people do you see walk around with their head way forward on their shoulders? Look at their belt. I'll bet you that their belt is tipped way down or their belt is tipped slightly up. And all of that movement is translated into the neck and the shoulders, creating the chronic pain that we feel in our neck and shoulders. So the knee is a pretty simple hinge joint, and basically, for the most part, it just moves back and forth. But if we are externally rotating, now we're forcing the knee to move in this oblique direction. If we're internally rotating, then we're forcing it to move in the opposite direction. Stop and ask those of your friends who have had knee surgery and ask them whether it was the medial or the lateral meniscus that was torn, and then watch when they walk and see whether their feet are externally or internally rotated. If you're externally rotated, it's my bet that you're going to damage the medial meniscus. And if you internally rotate it, you're more likely to damage the lateral meniscus. So Knee pain associated with Morton's toe? Absolutely. With chronic neck and back pain? Absolutely. So here's what I think happens. If this was my foot, and you can see there's that first metatarsal, so here would be the ball of my feet, or the ball of my foot, and here's my toes out on the end. And I'm not so much concerned about the toes as I am with the head of this first metatarsal, or the big knob at the ball of your foot. So as you step off, there it is, dangling in the air. And the body then, for the most part, externally rotates to get weight onto that first metatarsal as we push off. And 20% of the time, it internally rotates. Same thing, we're getting weight on the lateral 3 metatarsals. So how can we fix that? Well, the answer is pretty simple. A shim under that first metatarsal, and now as I step off, that first metatarsal kinesthetically feels support and does not have to rotate. So what do you use for a shim? And the answer is this little package of felt. Cost about $3.50 at Home Depot. It's Surface Guard. This is the medium duty felt. They also sell a heavy duty felt that's twice as thick. For most of us, I think that the medium duty felt is the right solution. And as you can see, when I put that piece of felt or that shim underneath that first metatarsal, then there's weight at the head of that first metatarsal. And what I see in myself and many, many people who I have suggested and try this shim, their feet also walk straight ahead. The carpenter in me says, the mechanic in me says, straight ahead has to be better than external or internal rotation, and the wear that that's going to place on the knees. So why should this internal or external foot rotation affect our hip? Well, I'm not a doctor, I'm a massage therapist, but this is what I think happens. If this was the hip and the acetabulum in the hip, or the cup, the ball and socket joint, the socket in the hip, and here's the femur plugging into that socket, if the feet are tracking straight, there's lots of room inside this ball and socket joint. But if the feet are externally rotated, now the ball is hitting the edge of the cup. If the cup rotates forward, if we get an anterior pelvic tilt, there's slightly more room, slightly less wear on the hip socket. If the foot internally rotates, then just the opposite happens. The pelvis almost always tilts back, or posteriorly rotates, again to provide a little bit more space for the ball and the socket joint. So this is what causes the lumbar to have either too much or too little curve. I measure pelvic tilt between the aces and the piscis, the anterior superior and posterior superior iliac spine. So a line drawn between the aces and piscis for men should be between 0 and 10 degrees. For women should be between 10 and 20 degrees. Nobody should be at 30 and 40 and 50 degrees, as I often see on my clients. So in essence, that's what I think happens. And if a 50-cent per shoe experiment can alleviate your chronic pain symptoms, it seems to me like a pretty inexpensive experiment, certainly a lot less expensive than surgery. So do I guarantee that your pelvis will go back to a more natural tilt? I do not. But for 50 cents, is it worth the experiment? Yeah, perhaps. A knowledgeable body worker, somebody trained by Eric Dalton or by James Woslowski, I think is far more likely to help bring your body back into normal balance. So you choose your surgery or a simple shim and perhaps some body work. So how do you create this shim that I keep talking about? There's 2 pieces of felt inside this package. Take one of them out, cut a piece off that's approximately as wide as your big toe, then cut it in half, and you now have a shim for each shoe. It's self-adhesive, so if the inserts come out of your shoe, take the insert out, glue it underneath the insert, right where the ball of your foot is going to land on it. So in this case, it'd actually be closer to right here. The toes are up here, ball of the foot's right here, the shim is right there. If the shim does not come out, glue it on top on the insole of your shoe. If there's any increase in your chronic pain symptoms, take the shim back out, go back to what you've been doing. I've very rarely seen an increase in pain and almost always seen a dramatic decrease in pain symptoms, and combined with a little bit of body work, I've seen pain symptoms completely go away. So this is how you do it. For more information, you can go to my website, www.toeclinic.com, all one word, or natural-movement-therapy.com, or Northwest Advanced Medical Massage, NWAMM.com. There's links on all three sites to get to instructions on how to create the shim. I hope this video helps some of you. My passion is to reduce chronic pain. The views I've expressed about Morton's toe are in no way endorsed by either James Wisłowski or Eric Dalton. However, there is a lot of information if you Google Morton's toe on the internet. I do know that not all massage therapists or all body workers are created equal. I also know that those body workers that have been trained by James Wisłowski, W-A-S-L-A-S-K-I, or Eric Dalton, have been taught information that in general is leading edge, clinically researched information, not always available to other massage educators or bodywork educators. So good luck. If you find this video useful, I would much appreciate if you leave a comment on my website, natural-movement-therapy.com, and let me know what you think.